Welcome to this starting meeting for the project Health Games. The project is a development project funded by the EU Interreg. The aim is to work with how serious games can be developed to meet aims in the healthcare sector through a cooperation between companies and hospitals. The partners are from Germany and Denmark, and for discussing the opportunities on how these new tools can be used for patients and clinicians, we have a panel of people from hospital and industry. And allow me to introduce everybody. On my far right side, we have Peter Jest, who is a medical doctor and chief medical officer at Odense University Hospital. We have Mette Maria Skjødt, who is the charge nurse at Odense University Hospital. We have Anne Munk-Harti from the Universitetsklinik Slesvig-Holstein. She's also a medical doctor. We have CEO Kim Görlitz from Reading Advertising Agency in Odense, and we have Simon Enfeldt Nielsen, who's the CEO, PhD, and from the Serious Games Interactive. Before the panel discussion, we will ask Peter Jest to give a short presentation of the project. Please, Peter.
Thank you. Colleagues and partners, I have been looking forward to welcome you to this kick-off meeting. This is just to show you an example of a big hospital. Odense University Hospital is a main center in Denmark, in some aspects covering 1/3 of the Danish population, for example in certain cancer diseases. And we have to think of the future in the leadership of such a big hospital. We have to think, because of the demographic changes, how we could work in the future, for example, using new innovative technologies. Why do we insist on this innovation? We are cooperating and competing with a lot of hospitals in Denmark and outside Denmark. We have to recruit intelligence. We have to work in a European and international framework, and working with sensor technology, play health and clinical telemedicine solutions, we can differ from other hospitals, and it can be crucial to the future self-acting patient. So we are thinking in two ways of the future hospital: the highly specialized hospital and the hospital at home. And we want to change the way we are working in both hospital areas. This project, Health Game, is about using serious game for learning and communication in hospitals, and it's a way to try to design games for a purpose. First of all, it's cooperation between organizations with clinical qualifications, for example hospital and also private hospital medicine experts, and in companies with experience with IT and the game industry. Games, we know games are a billion industry. Why are serious games not? And perhaps it will be in the future. The project concerns of 4 partners: Denmark, Odense University Hospital, where Palle Møldrup is project manager; Academy of Professional Higher Education Lillebælt, where we are for the time being. Project coordinators Henrik Hjort and Torben Hansen. In Germany, it's Universitätsklinikum Schleswig-Holstein, Campus Kiel, with project coordinator Felix Prell, and Fachhochschule Kiel, University of Applied Sciences, with project coordinator Melanie Voigt. The objective of the Health Game is to study the potential of developing games to the healthcare sector. We want to describe best practice between the game IT industry and clinical domains. We want to map existing solutions concerning health game applications, and we want to answer some questions. How do we utilize this knowledge and experience? We have to, during the project, to develop 2 to 4 prototypes with market potential, and We have to, in collaboration between the partners, to establish health games applications and draw some roadmaps for these applications to become tested, both in clinical environment and in a commercial setup. It's important to promote business opportunities through this innovative learning and matchmaking between the partners. And we will make some set up of masterclasses targeting the awareness of game technologies as a tool in rehabilitation, for example, and in communication, and to make some matchmaking masterclasses across the two partnerships, the industry and the hospitals. There's an important interaction, and we have to remember this interaction. And if any of you outside this room and out in the world have some ideas, please contact us whenever you want it. This professor from Boston, Harvard Business School, has said that a lot of modern innovative medical technology is delivered in an old-fashioned way. And the aim of this project, the perspectives, is to try to meet the future patient in a new way. And one of the ways is to meet them through using the game technology in medicine in the future. And that's what we will hope will happen. Thank you.
Thank you very much, Peder. And you are indeed welcome to join our debate already now. You can do that through SMS. If you have some questions for the panel, you can ask them directly. You can just send an SMS to 45 for Denmark, then 26187002. So please feel free to join the debate already. And we will talk about how clinicians can use serious games and health games to benefit the patients. And we'll, of course, also talk about which markets will emerge for companies. Anne from Kiel, please tell us, in what segments of care and health do you think that games will be relevant?
Okay, I think that it's that they will be relevant in many segments. At first, they may be used for introducing like certain surgical procedures or kinds of medical treatment to the patient. So that's more kind of teaching to the patient. And in the second step, I think they can be used so that the patient understands what is done and what is recommended for his further life, and so that he understands and is able to take messages home that he might change his life with, so that the games may be used like after a big surgical procedure. He knows, okay, now this has changed in my stomach or is different, and so I have to learn how to take up my the normal way of life to keep on going. So that's maybe only two aspects for those games.
And certainly motivation is a key factor.
Yes, that's the basic for it. The patient has to stand behind this new adventure, like health games are right now, and he has to be motivated to work with the doctor and to work with himself. So especially when he has left the hospital at home.
And already now people are using social media to upload their latest track record. I've just been out running, or I just had a swim, and they're sharing that with the world. And now you can share that between patient and doctor as well.
Yes, of course. The games are supposed to be a part of normal life. So it's not like only medical treatment and I have to do this like homework and so that I can become healthy. So what we do now is like play games in the afternoon or so, and why don't play a medical game, which has a benefit for myself. And so they have to be that normal or as normal as possible to be a part of the patient's life. Yes.
And the development of games is huge now. So you can talk about there's a tipping point, so to speak, where now it's almost become mainstream. When do you think that happened, and why does it happen right now?
Well, I think it happens right now because gaming has become much more popular. It's everybody is gaming. So of course we are learning now that there's a huge potential in gaming, and the way to learn through gaming is obvious a good way to work around with your own health. Also, I think that there's a very important aspect of it in this about creating social communities within patient-to-patient communication. I myself have been a part of a control program, being a former cancer patient, and I think that a lot of that experience is rather one way down. It's from the doctor who communicates to me, not very much the other way around. It's expert to a non-expert, and that could be done in a much better way if we use games.
So you think that also, in terms of the own program that you've been to, that keeping motivation high could be an object?
It's keeping motivation. It is also about creating more knowledge about what you are and what you do that will actually make the doctor better. And the interaction between the doctor and the patient's relatives and patient to patient could all benefit from using game technology, I think.
So you're also talking about an increasing in the learning curve from the doctor's point of view as well.
Yeah, strongly.
So, and it is true that some patients skip their treatment. So, and perhaps the gaming could actually help them not do it because they would be better motivated.
Yes, of course. I mean, some patients, they don't understand why we as a doctor ask them to do something or to come back for some like sonography or any other CT or so. And if they understand by using health games, then they are motivated to do what we ask them for. And so this keeps like a circle running, but it's all for the benefit of the patient, of course. And so for his life, yes.
And Simon, you're actually producing games. Please tell us a little bit more about the kinds of games that you're producing and why also you think that all of a sudden games have become like mainstream phenomena.
Yeah, I mean, just to start with the last one, I think that I agree very much with Kim that that there's a tipping point in terms of social media, and there's a tipping point in terms of games being mainstream. I can also see from my perspective that the production cost is going down. I mean, you can both make these very expensive games that are getting more and more expensive, but there's also coming more and more cheap games where can you actually do more than you could just 5 years ago for a very small budget. And that makes it, of course, much easier to try out new stuff and hook it into new places. I actually also think that the interfaces are important. We have touchscreens now, we have gestured games, we have 3D cameras, we have sensors, we have a number of things that make it much easier for non-gamers to use game technologies and to interact with these things. And that also makes the barrier to do these things much smaller. We've been playing around with and doing projects with most of these different interfaces, all the way from the quite complex ones in a game about post-traumatic stress disorders, where we look at people, how much they sweat, and measure that, and then use that as a feedback for them to make them conscious about their stress levels in relation to going back at the wrong time to battle mind. So if they see a dark door or something like that, they get anxiety, and they should deal with that. We've also been doing games for chronic pain disorders. And we've been doing stress games, how to manage stress and work with that, different dilemmas in a working situation. We've been doing cognitive training for elderly people, and are now expanding that to rehabilitation of people in neuro centers. So we've been doing a variety of different things. It's on different platforms, it's for different target groups, it's for different places in the health sector. And I think, as just been said, I mean, there's a very broad potential in terms of where it can be used, whether it's been for prevention or treatment or, yeah.
And what are your experience in terms of these are very serious conditions that you're treating with foolishness? Like this is the way that games have been portrayed. So is there a dilemma between these things?
I think that's actually that's where the kind of mainstream part of games also come in. That in the old days, which is not that long ago, but you actually got some opposition towards using games just because they were dangerous. They were just about shooting people. We don't experience that anymore. Now the challenge is on a more, you can say, professional level. Do we actually align the motivation, the game goals, you can say, with the learning goals? Are we focused on the right activities? Are we getting the best matches between the game mechanics and what we want to achieve from this? In that sense, we're also taking a big leap forward, I think, because that will facilitate that game developers like me and professionals from the health sector can start in a much more, you can say, rich and constructive process. Not talking about whether the games are dangerous or addiction making
or foolish. Sorry,
or foolish. They definitely are that, but I mean, in a much more constructive, instead of wasting time on some of these things, which are obviously important, but not all the time we mention games. So.
And Mette Maria, you've been actually, through this project, already been traveling around. You've been to the States, you've been to Asia. Please tell us about some of your findings.
Yes, but I think the process has been for years now that we've seen games for fun, and we've seen games for education, and now it's time to see games for health. And I think both the industry and the hospital and the patients are ready to do that and to experiment more with that area. And the things that we see we can use this in the hospital is it's prevention, it's treatment, and it's training. And in combination with these areas, there's a variety of areas to work with. Exercise, it could be motivating the patients, it could be a change of behavior. I think there's a lot of areas.
Could you give a few examples of these ideas?
Yes, some of the projects we saw in Korea. They have an association of serious games, and one of the games they were working with at the moment was a game for children to visualize cancer treatment for children. So that will be something about shooting with chemo, shooting cells with chemo, so the children could see how it will explode, and then the thought is that they will transfer that to real life. And that is also how we see that we can use the game. We have a huge project at the moment, Paris, where one of the results is that we need to have a variety of offers to our patients. It is, of course, necessary that we have communication face-to-face with our patients, and that is still an aim we have. And also we have the books and the handouts, but also an offer could be using games, using more technology. And this is why we think this is interesting for us to join in. And we know that the patients, this is what they do, this is how they work, this is how they have been teaching. So they also ask for this.
And perhaps a game about chemotherapy makes it easier for especially children to explain it to their friends in school. What is it that I'm going through here?
I think both the way of hearing it and explaining it, but also the interesting of being willing to hear it, because it's not always nice for a child to hear about the facts. So this could be another way round to inform kids. I think we have to be creative and think in new ways, and this is one of them. It can also, we just saw in the States where they were using games or part of games as a coach program for the staff to do things better. Lack of time is always the issue, and this is ways of finding new ways of being better to practice via games.
So you can treat more, or what do you say?
So you can treat better.
Yeah. And more.
Good.
And when you have patients, they have heavily Googled up their disease before they reach you actually, and they have tons of questions.
Yes.
So could games actually prepare them and you better than today?
Yes. When we look like 50 years ago, so patients came to the doctor and the doctor said, okay, we have to do this or that. And then the patient went home and, yeah, it was done the way. But now the patient comes and has questions. Maybe he has seen like 2 or 3 doctors before or 2 or 3 hospitals before. And then he decides the way of treatment he wants. That's a different way of medical treatment right now. Our job right now is to recommend treatments, like to offer him different ways and to tell him what are the pros and cons for each treatment. And so by teaching or explaining everything, like health games can help us with that and give more information. But they are not only, or they are not only allowed to be like, give the patient the iPad or something and now read it or play it and then you know everything. So the basic is always the contact between the doctor and the patient. That's the basic of everything. And on that we can add different stones, different steps of treatment and to come to a decision together. I think that's important that we work together with the patient and we are not allowed to stand over him or and to decide for him. So we have to decide with him. And those games are able to help the patient to find the right decision or the best decision for himself. It's not, you have patients like both like 50 years old or 70 years old and you treat them in different ways for different reasons, but the patient has to be capable of understanding your decision or the decision and to stand behind it. That's important.
So you could actually have patients meeting up with the first meeting with you and they already played the game, so they are already dressed up for this conversation. They know what it's going to be about, and they will have even better questions for you,
yes, of
perhaps.
course.
Yeah.
They raise up with more questions and it's our job to explain as good as we can.
So Kim, in terms, you work in advertising as well, in terms of social media and making communities, how can we benefit from a lot of people sharing their knowledge in this field, which is obviously not entertainment, but this could be very fruitful to share knowledge in this sense. How can we build communities about that?
Yeah, well, you can build a community around everything that interests a group of persons. And of course, if you have a disease and especially when it's you're in a lifelong treatment, of course it's obvious that you can build a community around that. And the good thing is that you can share the knowledge from each patient. Like talking about diabetes, it's important what you eat, so they can share recipes, and it's very very effective way to do that, to build a community. If we use gaming, we also have that. The good thing is that we can create a level of knowledge that is that comes from the professionals, that comes from the doctors, because pure and simple patient-to-patient communication also means that there are big misunderstandings that could be spread. Here we have a place where we can ensure that the medical view is okay.
So instead of rumors, it's actual knowledge that we can use. Yeah. Simon, you worked in this field. You wrote a PhD about it. Tell us a little bit about the how does gaming affect us? When you talk about a game like World of Warcraft, you have levels and you have some kind of a dopamine exchange in the brain, and you feel very happy when you reach this level. You talked about there are some 4 different aspects of gamification. Was the word you used?
Yeah, I mean the big boss. I mean, serious games is at least 50 years old as a term, but it kicked off in 2002 and had a lot of attention. And now 1 or 2 years ago, people started talking about the new thing, gamification. And you can say in the old days, you talked very much about serious games as something you made in their own. So you kind of said, okay, we need something to train a surgeon. We make a serious game because that has some advantages. The thing with gamification is that it to a larger extent extends from the advertising industry mixed with the gaming industry. And they basically say instead of bringing the training to the game, we bring the game to the training. So gamification is much more about actually embedding game mechanics and game technology in the actual site, services, products you already have. So, and that gives a number of advantages. So instead of doing a game about taking your medicine, you make game mechanics embedded in the process of actually taking these things. So for example, an SMS service where you get points for turning up, getting points for doing things, maybe getting a new level in doing that the right way. So it's kind of a paradigm shift in that way, and it has a lot of advantages because it gets much easier to embed it in the actual praxis rather than being now we did a product and then that's kind of it. In this way, it gets more integrated from the start on. And the things you're very much aware of when you build up these things are the kind of 4 things that you look very much at and kind of become the 4 important principles. Not all that agree with these, and there's a lot of ethics considerations, but we won't get into that. But basically, you have 4 motivating principles that are very important. And the first one is status. The second one is access. Then you have power, and you have stuff. And you can say the first one, status, is kind of the king of them all. And it's basically about, as people, we like to show that we know something. We like to be recognized that we're attached to something we find meaningful, is good or interesting. So, I mean, I have a shirt on and, I buy extra to pay extra to get a horse on it, which is of course kind of silly, but I'm stupid because I want to show some status.
You're into gaming, of course.
yeah, that too. So I mean, it's a very cheap way to a producer to actually give me some extra value, and that can put me in the horse group of people. And the same way you can do it, that's actually what almost any game do. They have some level systems. You get status by that. When you go up in those levels, you get access to new stuff that makes you feel important and make you want to achieve even more. You get maybe some power, so you want to get even more of that. And sometimes you even get some stuff, whether it's physical or virtual, that also want to get further. So as you said in the World of Warcraft, you level up, then you get to slay bigger monsters, go on more interesting quests, you get to be in new interesting guilds, you get to kill newbies, people that hasn't played that long, people find that's cool, and you get bigger and better swords. And in that way you have these very fundamental motivation principles that you would actually recognize in most successful games out there.
So what you're telling us also is that you don't actually have to produce a game to benefit from this knowledge. You can actually just take the knowledge and put it into treatment already, or the communication between doctor and patient.
Yeah, I mean, you just have to be careful that the learning goals and the game goals are aligned, because the gaming will be very powerful. So if you're not very careful how you design these things, you suddenly will have them. You mentioned the fly in the toilet. That is a brilliant example. It's a small game where you have to control where you're peeing, because you've put a bumblebee there. And of course, let's say you've put it too much to the right, then you would have a disaster. You would basically have stuff all over the toilet. And that that on a very, very simple level, it demonstrates the power of gaming and goals of making that motivational. But it also communicates very well what happens if we kind of mess it up. So we have to be very careful to get that balance right. I mean, there's another famous example from hybrid cars, where you put in a small dashboard, you have your own little plant, and if you drive fast, it kind of withers away because it don't like that, and ecology and stuff. And if you drive slow, it kind of grows and get bigger. And one of the problems they have is that people drive too slow on the highway. It's bad game design, but it's just again, it kind of shows how often would you actually see people drive too slow in their car, to because there's a small little plant ahead of them.
So there's some terms of logics and incentives that we have to align.
I mean, I've been killing wolves in World of Warcraft for 12 hours like this, just because it would be the easiest way for me to level up. It's that silly sometimes. So you really have to kind of recognize that these are quite powerful mechanics to control people and potentially manipulate them. But we might as well use them for good and not only for fun or for evil. There's also propaganda games and stuff like that, but that's another discussion.
Let's take the good part. Lady Maria, how do you see what could be used if we take all the good part of this gamification theories?
I think what I hear is that it's important that the staff at the hospital are participating in this. We know for our patients that they're really keen on getting information on any kind of diseases, but the internet at the moment it's so huge that they're just looking where to find something, and I think it's the same issue with games, that it's very important for the patient that it's something that we recommend. This is how we do it, and this is how we see it, and this is how it should be, and in this game you can find what we also are standing for. I think that's very important, that it's just not a game. We have this English game, you can just participate in that and everything will be fine. I think we have to have some very close connection between the nurses and the doctors at the hospital and the game.
Some kind of validation or curation, actually, so that you will put a stamp on it that this is good for you to play.
Both a stamp, but also that you can, what we say in the hospital, that you can see that in the game. Mm. So things are alike. I think that's very important for the patients, that it's not just a game. Yeah. It is the game.
So, what is the culture right now for making these collaborations between people like Simon and Kim and yourself? Like, what is the culture right now, and how do you see it?
Yeah, but I think we are there where both the patient and the staff are asking for better ways to do things. They think this is interesting. Both the patients and the staff are using technology more and more in their everyday life. So of course they want to use that in their work as well. So I definitely think that everybody is ready to do this, but it has to be in a very close cooperation to make it good.
So, and will you be ready to be accompanied by a script writer and a play designer for a week to figure out how to improve treatment on patients?
Yes, why not?
Good.
Yeah, I think that's the best way how somebody can is able to get the information directly from the doctor to see how it's going, but not. He's not only supposed to follow the doctor, but also the patient, so that he's able to realize the problems the patient has outside of the hospital to live or to make those recommendations that the doctor has given him to really live them. So. He has to come with both of us.
Yeah, good. And Phil, you had a remark?
Yes, but we have a challenge because in the medical world we need to have a lot of evidence of what we are doing. And that's one of the problems. The games are there. There's a lot of possibilities. The patients expect that we are aligning the rest of the world, and we are a little slow at the hospitals. On the other hand, we know that the patients precisely know why they are arriving at the hospital or at the doctors. They want to have the treatment that is necessary for a normal life without the help of our programs. So at the same time, using these possibilities, we have to make evidence that it's really are helping the patient in different ways. Not for everything concerning these areas, the SMS solutions and so on, but when you are going to look at the distinct disease, you have to get evidence, or else the staff, the clinical staff, will work as they always have done, in an old-fashioned way.
Yeah, and Simon, you have had some of the same experiences.
Yeah, I mean, there's one thing. I think evidence is obvious because it's such a huge impact you potentially do if you mess it up, and I think that's the way it's supposed to be. I mean, I think that one of the experience we have is that sometimes the incentive structures for the health system to change and to optimize their structures is maybe not always powerful enough. I mean, we had this I mentioned this very concrete example where you have rehabilitation, they get, paid per hour. If you then do a program that, optimize the use of their hours, they actually earn less money. And in that sense, there's not really an incentive for them to optimize their structures. And as I said earlier, also I don't know how many of these challenges there are, but I mean this was a very vivid example for me. That was a bit discouraging in some way.
At least an economic incentive was lacking. There was another incentive, perhaps, in helping
unfortunately, out. Unfortunately, I think that in these times, the financial incentives are quite powerful.
Yeah. There's actually a question now from you watching, and thank you very much. There's a question, and it relates to you, Simon, because you are making these games. Does developing a health game differ from developing a traditional game?
Yes and no.
New question, please.
I mean, in a lot of ways, the technology is the same. The graphics are the same. You have some special challenges in relation to what's the hardware, what's the stability, how thoroughly it has to be tested, and that kind of stuff related to technical. But it's not really, I mean, at the core, that's really pretty much the same. The key competence you can say we have as a developer in this space is really that we talk to the experts, and we are quite good at trying to make that interpretation between and that creative process between, what will work in that context and how will that translate into a game, and then trying to find ways to make that work within, you can say, budget and technology constraint and these things. So it's in a lot of ways, it's not really that different, but you have a very important element in the core that's really about translation, which is very different, I think. And then in reality, we also have, I mean, it's different things that are important for a health game than in for example, a AAA game. I mean, when we do games, we have lower hardware expectation than most commercial games would think was acceptable, because the graphics are usually not that important for us. And in some, it's very important because you have special visualization games. And then it's all over. I mean, it's even higher than the AAA games. So there are some differences, but I mean, the base level is really very much around the same.
So could you imagine that it could actually be a problem with the professional gamers, so to speak, people who play games every day, that they experience the lesser graphic design on games, and they think this is not as good as as the traditional games? Could that serve a problem?
No.
Good answer.
No. I mean, the thing is that, actually people play a lot of small games. I mean, we all know the games that are in the stores, and they sell quite well. But the biggest games are really made on quite small budgets. I mean, Farmville is not a huge budget. A lot of the games on that small phone there is quite cheap to make. So it's not like there's necessarily an opposition between those things. It's very much a question about framing and about, thinking a bit creatively. And that's also something we have to struggle with sometimes. But games can be fun in a very, very simple way. You just shouldn't try to make a World of Warcraft on a shoestring budget. I mean, that's just plain silly.
Are we facing a new business model, Peter, in terms of, you talk about the demographics, that we have to think more in this way, and then we hear about that it could be too huge a success too soon because we will treat very many patients, and Simon is talking about the incentive, the economic incentive for using gaming. Do we need to think about new structure economically?
Absolutely, because one of the limitations is on one hand, the competition inside the industry and the firms. And because of this competition, the European Union have made a lot of difficult rules when we have to cooperate. And each time we show up with a good business case to the board of directors or to the governments even, we have some problems. The project will stop because the rules are so difficult that the leadership don't take the responsibility for trying to make some solutions. On the other hand, the politicians are like the rest of the citizens. They want to live and work in this way as we have described it here. So in a way, I hope a little that the politicians will come and help us to give us some solution in the way we are working together. We have to have a challenge in the leadership of the hospitals and in the board of directors, and we have to dare to do something about this. So a lot of our projects is flowering, and then we try to get them through. We have tried this in, for example, a lot of years with telemedicine solutions, and still there only are 1 or 2 or 3 shots in Denmark concerning telemedicine solutions. They are traveling from abroad to see our good telemedicine solutions, but it's not daily business at the hospitals, only at our hospitals, of course, and that's good. But we need to think in another way, not only in the inventors and the game industry and our good colleagues in the clinical staff. We have to help them because we are helping the next patient. We are, in fact, sleeping a little in the leadership.
So, Kim, you work in advertising. You should help them out. What are the good stories to tell?
There are a lot of good stories here, and quite obvious. There's good stories just within the business model. We just have to look at it in a little other way than we do now. There's a lot of money in making the patients better patients. There's a lot of money making the doctor's information the patient's information. There's a lot of money in making people going home from the hospital earlier. There's a lot of money in getting people healthy and living a better life. But we can't take that money and use for developing games, and that is wrong. That is where we have to have the political system to think about the broader goals and make us able to capitalize those goals.
And that's why it's important with such a project to show the value of thinking in that way you are describing.
There's another question from SMS, and thank you very much. It's to you, Anne. It's do you think most medical doctors will accept health games?
Yes, I think they will. As I said before, it's an support in the communication with the patient, and it's a help for us. But it's not supposed to reduce the communication with our patient. So it will help us, especially on the way that the patient understands what we want from him, and that's the basic, as I said. Yes, but I think that they might help us a lot for the treatment, and especially for this learning process that the patient has to go through. The patient has to be taken by his hand and led through all different steps of his disease. And we, as doctors at the hospital, we can only take him through the first steps, like for surgery or some other medical treatment. And afterwards, he's standing alone at his home and has to go on somehow. And of course, he can go to his doctor outside, but that's like 5 or 10 minutes of a talk, and then he sits alone and again in his apartment and thinks, why did it happen, and why did it happen only to me, and I'm here all alone. And so when he is understanding and capable of understanding and working with this information at home, then I think it's a big support for the patient and for us.
For you as well. How about the rest of the staff, Mette Maria?
Yes, but I definitely think that the staff are ready, both doctors and nurses. But I also think that if they are not ready, it is our challenge to make them ready, because as Peter said earlier, the demographic is changing, and we are getting more older people, we are getting more chronic diseases. It is important that the healthcare system is looking of new ways to treat and to train the patients. And as you mentioned earlier, the new hospital will be in the patient's own home. So we must, the staff must be ready to find ways of treating patients at home, and games could be one of the ways. And I think the staff is ready to do that. And the staff also now know that something must be done, because we see these patients in the hospital at the moment, and it's increasing. So I think
if I fully agree with you, yes, a lot of doctors, a lot of nurses and therapists and so on are ready to work in this way, but it's much about working with the soft things around the patient. How we behave, how we communicate, how we navigate with the patient through the pathways and so on. But if you go to the doctors and nurses and so on, working with the hard stuff, the diagnostic procedures and so on, they demand evidence of what we are doing. Very often in either qualified research areas or in randomized trials, and it takes time and it costs a lot of money, but on the other hand, that's the way to convince them. Now you can't go against us anymore, so we need to have some projects with in randomized trials to wipe in the face of these persons.
And Simon, you talked about asthma treatment with the use of serious games. That was many years ago with a very high hit rate. But even still,
I'm not sure that they would qualify in the medical terms of controlled, randomized, completely blind trials, etc., etc. But there has been quite a few studies that looks pretty positive. I mean, the asthma and diabetes games from actually back in when Nintendo was ruling in the earlier console generation, I think late 80s or something like that, showed that there was a huge drop in visits to doctors for these diabetes children, like 17 and 80%. And of course, that's I mean, you make a game and then you save a lot of hours in both, parents going there and doctors spending time on it, and loss quality of life, etc. But they still didn't manage to put a business model together, even though they had a very strong product and they have quite some evidence for it. The Hope Lab that made the cancer game Remission also did a number of studies, both in the US, I think, and in the Netherlands, that had some promising results in terms of making the cancer treatment better by giving patient this efficiency, so they kind of felt that they could beat the cancer, and that had some positive results in the treatment. But I think definitely, yes, I mean, we need more of these. I mean, it's a very also evidence-based industry, and that's probably also why it's a bit slower than other sectors. I think, though, that the health sector has one big advantage compared to, for example, the school system, which is that the school system see the consequences when they do bad 20 years later. You see it 20 minutes later. So, I mean, there's at least in a lot of areas. I mean, that's one of the big problems in the school sector that has also been very much into these things, but it's very difficult. I mean, they're not really measured by quality. It's kind of a diffuse system, whereas in your world, it's much more kind of, okay, 10% got better, 20% didn't. We had 20% fewer critical areas, etc. And I think that's actually a big advantage, because that assessment methods maps much easier to the way that the games are structured. So I don't think it's actually that difficult to do these control trials if you have the money.
Love that. Did the patient live or died?
I mean, I saw a talk by a Norwegian company, and that you also mentioned that the endoscopy. Yeah. And they very concretely had made, this was more of a simulation than an actual game, but, they had basically said, okay, how did they perform before and after doing this game? And, they had 7 critical areas where it would potentially be life lost, and 20 or something like that would be minor. And they played the game for a set amount of sessions, and then the critical areas were halved, and the minor ones were also like 30% lower. and stuff like that. That's really easy to understand, and it's really not easy, but it's you can see very obviously that it will save money. I mean that people don't end up with complications and end up dying.
But the doctors want evidence, the patients want evidence. I'm sure that you want it as well, because it will thrive your business. So how can you speed up that process? Is that at all possible when we talk games that are culturally connected to children, and now all of a sudden we're talking about it in a serious sense? Does that cause a dilemma that we're talking about evidence in terms of serious games, or could we actually make a leapfrog? Yeah.
Well, I think that one thing we have to do is to take the low-hanging fruits, and some of them would be where we talk about behavior being an important part of the treatment, because behavior we can control, or we can try to make people manipulate them to do whatever it's good for them. So that would be one way to go, and then perhaps you had to find out 2 or 3 or 4 projects, and then obviously
so
one
the
of them
staff will be accustomed to use the game technology. On the other hand, the industry are not very patient. They want to earn their money.
We have to.
At least this year.
But I think that
So you have to put money in the projects too.
But I think that not all the doctors are maybe against health games, or the nurses, and so especially if we look at the development that we have right now at our hospitals, that more techniques are getting into our hospitals, robotic surgery and so on, which is recommended by the doctors, and the patients ask for this. And I think this is a trigger as well, like patients asking for it. So the doctor saying, okay, we have to read about it, we have to inform us about it, so we get it into our hospital as well, because the patients want it. That's one factor, and we want it ourselves as well, because we see the benefit. And so I don't think that it has to be introduced like step by step, not all at once. And so that, but I think then that the doctors and the nurses are not against health games.
No.
But so that they
and the funny story is that, for example, the operation robot, Da Vinci robot, there's no evidence of using the Da Vinci robot, but there are 200 of them in Europe and 400 in the States. So the doctors love to work with that instrument, and now the patients expect to be operated during Da Vinci robot. So it's a generation working, I think, using the new technology.
But I also agree that it's important that we make evidence ourselves, and we already do that in some areas, but we can of course be better. But also we must be better to find the evidence that is already there, because in some countries there are evidence not specific on health games, but in this way of delivering knowledge. And I think what we must be good at is to find this evidence and to bring it in to this area, and to see some of it will fit in and some of it won't. And where we must make evidence is where the lack is.
Simon?
Yeah, I was just gonna say, I mean, this also, if you broaden out the areas just slightly, I mean, there's the visualization, virtual reality, simulation community that has overlaps with this and has a number of studies already. And if you kind of broaden it out just a little bit, then you actually get a lot of stuff for free. And the second thing is that I mean, the minute we digitalize things, it makes it possible to track anything. Because, you know, when you digitalize something, it's zeros and ones. And that means that we can basically, I mean, it's not really about setting up maybe a trial necessarily. It's basically just about remembering to ask the right questions in that tracking process, because we have the data, we can see what they do, and you know, we can see what happens to them.
And so that's a design issue, right?
Yeah.
And you work in the urology department. Yes. Could you imagine, like, what could be a concrete health game in your department?
Well, what we think about is like a game if we take out a bladder out of a patient because of cancer, and put in a new bladder. And this new bladder is not working in the proper normal way as our bladders now. And so what we think about is like inventing a game so that the patient goes through a day of his life and learning by playing how this new bladder changes his life. That's an idea that we have. And like going to a supermarket, buying good things, not buying bad things, and learning how to go to the toilet with this new bladder. That's one idea that we have.
And I'm sure, Simon, your company can make those kind of games. But as we've seen in terms of technology, you mentioned it yourself that the production cost it decreases. So what are the perspective in that from producer to user? That sometimes that in the near future the user of the games will actually become the producer of the game because you're making content management software for them. How far are we from that?
I mean, it's a good question. I mean, on one hand, you have actually several tool sets for primary school students making games themselves. So that's kind of, so that's kind of one. And then on the other hand, there's actually a very long way to actually making professional games. And then there's the middle between that is probably something like what we talked about earlier about the CMS systems, where you can change some content, you can update some small things, you can change the variables, where you still keep the game a bit more fresh, so you don't have to get the developer in all the time. But if you need major updates, you will still probably need a developer in the future. It's kind of like this is kind of an underlying battle. Some believe that all game development will be user-driven. I'm kind of in the other direction. I might be not entirely objective, but nevertheless, I think it's actually quite difficult to do a proper game, especially when we're in the more sensitive areas. So I think one should be a bit careful on just how powerful this will be. And the thing is also, if you are to be in these more complex areas, you have to be pretty smart and dedicated and have some time to actually do this. It's not just about, like in The Sims, uploading a new something. It's more complex than that quite quickly. But it's moving towards that direction. But I don't think it will ever be like that as such. But I think there will definitely be more empowered the end user in time.
So you don't imagine doctors playing doctor already?
Well, not unless you do a kind of a dungeon master game. That's a different, where you're the dungeon master in Dungeons and Dragons, and then you kind of control the yeah.
But actually, you could envision modules that, and if this works out in terms of the patient with the bladder, then you could change the narrative of the timeline between patient and doctor, and then you could just create a new game very simply.
Yeah, you could probably, depending on what the other operation would be. You could probably reuse some of it, and you can change. For example, if you had one scenario with a man, then you might want to do some that is more towards a woman, where you reuse some of the same assets, but still change the branches and some of the responses and stuff like that. And if you get new knowledge that it's better to drink water than soda, then you could also some of those things you can definitely do.
Now we have 2 minutes left this debate, so this is time for your best case scenario, everyone. So, Peter, what's the best case scenario for making health games?
That this project will bring us much more together in an international framework, and that we can see the challenges and the difficulties in both at both sides, both the industry and the hospital, and that we could reach some of the targets, at least some of the targets in the project.
Thank you, Mette Maria. Mm.
Yes, but I also think that it could be really, really good to have a concrete game, and it doesn't have to be a very big, complex one, but get a success with one game in the way of reaching a better healthcare system. I think that could be really good.
Sure. Anne?
Well, I agree with that, but I want to support the patients at first and to ensure their treatment that they have received from us, and I hope that the health games will get them there and hold them at a steady state. So that's my goal.
And Kim?
Well, yeah. So to help creating a game like that. A prototype, first thing, that could be really exciting.
Yeah.
Simon, what's your...
So I'm
you already
last,
in it?
right? I mean, Jesus. No, I think it would be great also to really have a strong, simple success story that you can communicate to decision makers, can attract more funding, can get the evidence we need. It doesn't have to be complex, it just has to work and be part of the practice on actual, hospitals, preferably in all of Denmark or the Nordic countries. Now you said best case.
And make life better for patients, of course.
Yeah.
Well, thank you all very much for participating today, and thank you all for watching. This was the starting meeting. We have 2 seminars coming up soon. We have one on the 23rd of November with 4 talks on how to adapt gaming to healthcare. It's right in this setting here from 3 to 6:30. And we have one again on December 8, talks on how game technologies can be integrated and be cost-effective in healthcare. Thank you all for watching, and thank you all for participating today.